Okay guys, if you're struggling with low back pain because it feels unstable or like it's about to go out, these 3 exercises are gonna be the ones you're gonna wanna check out. They're a progression, so if the lowest one is too easy, move on up to the next one. Guys, my name is Eric Christensen. I'm a physical therapist and owner of Chandler Physical Therapy. I'm here with Tim today. He's gonna help me model a few of these exercises, and they start from easiest to most difficult. And you need to make sure you pick the spot where you are the most challenged but not getting pain. That's going to be crucial here because we don't want you to have pain while we're doing these exercises. The other crucial thing that we want to check out is we want to make sure the back stays flat against the surface you're laying on. You arch your back off the table. This is a very common compensation when you get challenged in that position, so we want to make sure that we're deliberately kind of tucking the tail underneath it and flattening out that back against the table or surface you're working on. So the first exercise that we're going to do is what I call an ab press. And basically you're going to need a ball. It really could be anything to squeeze, but an exercise ball is very useful. Tim's going to bring his feet and knees together. There you go. And then in that position, what Tim's going to do is keep the feet planted on the table. He's going to take his hands and he's just going to try and smash that ball into his thighs. And as he does that, we get a reflexive activation of the midsection. And that's a great way to start building up that core stability. It's nice because the ball acts as a stabilizer, or causes the core to act as a stabilizer, but the core is not moving, which is often a sign of pain for a lot of people. The next progression is now Tim is going to take his knees and we're going to bring it up towards his chest. And what we're looking for here, go ahead and keep going up a little bit, there you go, is a 90-degree at least angle with the hips to the body. If the legs start dropping down, that's where we see that back start to arch. We want to avoid that. So we really want to bias keeping the knees a little bit higher than the hips. And then in that position, Tim is going to go ahead and again squeeze the ball between his hands and knees. And that again is activating that core. The last variation of this is going to be the most difficult. So we're going to start in that legs up position like we just did. Tim's going to squeeze, but this time he's going to take an arm and reach overhead, and then take his opposite leg and reach out along with that. And that's going to really challenge you because now we're moving around a stable core. And then you're going to bring those arm and leg back in, and we're going to switch arms and legs. But you're never losing the pressure of the squeeze there. And this is vastly going to be the most difficult. If this particular variation is difficult or too difficult, you could take just an arm or just a leg and keep everything else in contact, and that's a way to kind of play around with the variability on that. So if you guys have questions, put them in the comments below. I'd love to help fill them out. And again, like this is just a sample of them. If it's increasing pain, we want to discontinue it. We don't want to do that. But if you feel like your core isn't quite as stable as it needs to be, these are great options. Thank you guys so much for checking out this page and this channel. If you like what you saw, hit the like button. And if you want to keep updated on any new content we coming out for ways to better your health or keep moving better or treat pain, hit that subscribe button. And don't forget to hit that bell if you want to be updated every single time we add a new video. As always, stay healthy out there. We'll catch you on the next video.